I'm Dr. Gaurav Kharya. I'm a consultant in Pediatric Hemato-Oncology and Bone Marrow Transplant at BLK Super Speciality Hospital. You aim of changing a defective marrow, okay, because it can be because of any disease. The intention is to change the defective marrow with a new marrow. Allogenic transplant and autologous transplant. Allogenic transplant, where you are looking at a different donor. Autologous transplant, which is now recently termed as high dose chemotherapy along with autologous stem cell rescue, where you don't need a donor. The stem cells from the patient is taken out, they are preserved for some time, and then high dose of chemotherapy is given, and then those stem cells are given back. Thalassemia, sickle cell anemia, any other hemoglobinopathy. This defect can be because of any malignancy like blood cancer, acute lymphoblastic leukemia, acute myeloid leukemia. This defect can be because of any underlying immune deficiency, like some kids are born with immunodeficiency, like severe combined immunodeficiency. In bone marrow transplant, there is no permanent damage to the body, and whatever stem cells are being taken out, they replenish within a matter of maybe a few hours. Okay, so neither there is any short-term side effect nor there is any long-term side effect to the donor. It is rejection, okay, because obviously not all 100% of the patients who undergo transplant. Another risk is risk of graft versus host disease, where after transplant there is some degree of fighting between the new marrow and the existing and the previous marrow, which is called as graft versus host disease. So these are the two major complications. Apart from these, other complications are infections, which can be viral infections, bacterial infections, fungal infections. The parents need to know that what is the indication for transplant, and that there is certain risk of mortality and morbidity associated with it. After the transplant, again quite unlike solid organ transplant, these kids are immunodeficient for a certain period, okay, which may be 4 months, which may be 6 months, which may be a year, okay. So for this period, they need to take precautions, okay, to avoid crowded places, to avoid malls, theaters, all right, because they are at risk of infection. Once they are off immunosuppression, then there is no significant risk and their life is back to normal.